So, Gauteng Health MEC Gwen Ramokgopa is giving an update on live esidimeni corruption and misconduct allegations. We're going to take you live to that briefing now.
More than in any other province. These are the 6 strategic drivers of the recovery plan that we developed. You can see that it is the issue of governance, ethics and governance and accountability as a foundation, and the issue of innovation and modernization, and that's why the digitalization and the more modern equipment. Also the issues of financial prudence, very key to sustaining the health system. Patient safety and improved healthcare outcomes. You are aware that we did have a big problem with high medical litigation claims. And last but not least, to reduce the disease burden so that those that don't have to be sick must remain well. And that is important for the productivity of our country as well. Just here to share with you some of the highlights that Gauteng remained number 1 in terms of the ideal clinics. At 75%, we are not happy. We also want all the clinics to be compliant. And I must say that for those clinics that are platinum rated, whenever I went there, even unannounced visits, they would actually pass the test of that rating. So many of our frontline workers are doing their best to provide quality care. This slide, we were also assessing the compliance of hospitals, and we have also introduced now the ideal hospitals standards, norms and standards, and appointed a provincial accreditation committee of independent experts and stakeholders. So we are pushing all health facilities to be compliant to norms and standards of a quality health system that is highly reliable. The issue of governance, very critical. You can see here that the history of irregular expenditure, it was very high, and the trend is a downward trend. And part of the teams that we strengthened was the finance team with appointment of a CFO to help manage all these irregular expenditures throughout the health system platform. But we also have a delegated authority to the CEO of facilities in this regard. This is also a slide that raises an issue of great concern to me in particular when I came to the department, and that is the performance management system for senior managers was not implemented regularly. You can see that in 16-17 it was at about 78%. It improved to 98% in 2017-18, and for the past year, ended March, it has been at 100%. And to date, in the first month of this financial year, we have signed performance agreements with all our senior managers. And we've aligned these performance agreements with the policy imperatives, with the annual performance plan, and also to improve the frontline services. This is another intervention initially supported by one of our expert managers who we are very proud of, but who have since retired, Dr. Kinoshi from Steve Biko. So we started with him to delegate authority to CEOs. And I think many of you have experienced that CEOs are now able to speak to yourselves on matters that they are accountable for. Whereas in the past, almost everything was head office, without accountability at the health facility. And the key areas of accountability include financial, human resource, service delivery, in terms of clinical governance, supply chain, as well as the issues of communications and infrastructure. I must indicate that for the 7 hospitals, we've also introduced a much more strengthened hospital board system, where the hospital boards must have the mandatory committees in finance and audit, in clinical governance for patient care, and in HR as well. So those are mandatory. We've started there, and I have no doubt that the experience of these hospital boards will be that they are much more able to provide oversight and governance. This system will be rolled out to all other hospitals. This slide talks about the accruals. You'd recall that I did indicate that from 2008, the budget for central hospitals, whereas 60% was from grants, reduced to 30% from grants. And the impact then, amongst others, was that you would then have accruals, meaning old debt that you pay for in your new financial year. You can see that in 14-15 it was around 2 billion and cumulatively increasing. It was expected to be about 10 billion for 17-18. But between 17-18 and 18-19, a lot of work was done to ensure that we don't get into 10 billion rands. And you can see the downward trend. These organizational pressures cannot be rectified in 1 year, and we've given ourselves an MTF period, a 3-year cycle, to rectify this, whilst acknowledging that recalibration will also be important. This slide also looks at revenue collection. You can see that it has improved in the past 2 years. It was part of an intervention to ensure that part of the revenue collection above target comes back to the department to strengthen the health system from Treasury. Medical litigation. Gauteng is one of the provinces that had high levels of medical claims and litigation. This slide shows a downward trend. Part of the downward trend is our work with the SIU to identify areas where there are bogus legal claims. And working with the SIU, we've also just intercepted 36 million rands, which was to be paid irregularly. And what has helped is to put systems in place, electronic database of all the claims, making sure that we have experts to look at the claims, but primarily the clinical governance committees, when they identify any standard operating procedures that are not complied with, they are able to interact and intervene to reduce the serious adverse events in the health system. The issue of labor relations was also one area that destabilized the health system. You'd remember the strike of the forensic medical officers, strikes around PMDS and all that. We, together with the organized labor, the provincial multilateral monitors the health of labor relations in all facilities. You can see there are those that are green, there are those that are amber, where even when the multilateral sits, maybe the substantive issues are not dealt with, and there are those that are red, that are key risk factors for us. This is the last slide that I want to share with you on, okay. It's about 3 slides on the same thing, and this is really saying globally all health systems are facing pressures similar to what we are facing. It's a presentation or publication of
We've been listening to the Gauteng Health MEC, Gwen Ramokgopa, giving a briefing, a very detailed briefing on what is being done to turn the health department around. We're expecting her to touch on issues relating to allegations and findings of wrongdoing from the Esidimeni tragedy. She's also been dealing with plans to turn around hospitals in the province. There have been issues around the appointment of CEOs and processes that have been followed around strikes and labour relations at some hospitals. The department also expected to deal in some detail, hopefully, around issues of lawsuits brought against the department by patients who are either maimed or harmed in other ways at Gauteng hospitals. Our reporter Tshegoa Moagi is attending that briefing, and Tshegoa will give us a full breakdown of what's being discussed there in the next hour. This is ENCA Now.